Hi, my name is Emily Vaughn, and this is my video for health assessment. I have provided privacy for my patient. I am performing hand hygiene, and I'm going to explain to my patient what we're doing today. So, hello. We are doing the physical assessment, and I'm just going to be working from the top of your head down and to your chest. So what I'm first going to do is just notice her posture and gait. If you could just stand up for me and then sit back down. Thank you. I'm also noticing my patient's hygiene and her clothes. They're appropriate for the weather. She has no body odor, and she is well dressed. Next, I'll be looking at her head. So I'm just going to start with your scalp and just feel and assess right here. There are no masses. I don't feel anything there. Next, I'm looking at her face and looking at facial symmetry, noticing that her ears are symmetrical, her eyes are symmetrical. She doesn't have any masses or lesions on her face. So next, I'll be looking at her eyes. I'll be looking at the external structures, looking at her eyebrows, her eyelashes, her eyelids. And I'll just go ahead and use my light to look inside her eyes and see. All right, that's good. I'll now do Perla. If you could look at my light. And then I'm going to take it away, bring it here, take it away, look right there. Okay, her eyes are accommodating to light. They are equal, they are reactive. If you could look right here and then look at the wall behind me, and look at the light again. So her eyes are accommodating. Next, I would be doing the Snellen test, which would be with the eye chart. So I would have her stand 20 feet away from the chart and covering each eye separately. She would read the lines as far as she could, and that would test her visual acuity and ability. So now that I've done the eyes, I'll move on into the ears. So I'll get my light ready. I'll again be looking at the external features of the ear, looking at the earlobes. They're symmetrical. Then I'll look down into the ear, and I'll be looking down into the ear canal and seeing the tympanic membrane. I'll go over here. Same thing here, tympanic membrane. Looks good. I didn't see any signs of drainage or any pain. Do you have any pain with your ears? No. Alrighty. And next I'm going to do the whisper test, so I'll whisper. You could cover your ear and I'll whisper.
1, 2, 3.
Okay, I'll come over here and do it the other side.
1, 2, 3.
Okay. So now that I'm done with the ears, I'll move on into the nose. Again, looking for symmetry and lesions. I'll go ahead and look up the nose, and I'll be looking for any drainage. We'll be looking at the mucosa and the membranes, and then also the turbinates. All right, that's good. Along with your nose, I'll go ahead and do your sinuses. So I'm just going to palpate up here. Do you feel any pain?
No.
Do you feel any pain here?
No.
Okay. Great. Thank you. Next, I'll be doing your mouth. If you could smile for me. Okay, open your mouth. I'm looking at her teeth, her tongue, the color. Can you lift up your tongue for me? Okay, down there. And then I'm looking at the back palate there and looking at her tonsils and grading the tonsils. Great. Okay, can you swallow for me? Great. All right. If I could have you say ah for me.
Ah.
Okay, thank you. That would be for the gag reflex. Can you stick out your tongue? Can you move it from side to side? Perfect. Thank you. All right, next I'll be moving down into the neck. So I'm looking at symmetry again. I'll go ahead and palpate for any masses, any tenderness.
No.
No? All right, great. And I'll take note and look at her trachea there, palpating on each side. All right. And I'll go ahead and feel for a carotid pulse, each side separately. Go ahead and go up. And while I'm here, can you go ahead and move your jaw down for me? All right, there we go, perfect. Can you open your mouth? All right, there we go. Close it. And I'll be feeling here for the temporal artery pulse as well. Thank you. So I don't feel any masses or tenderness here. I can also do lymph nodes that I'll do down here in her neck and around in her back. Okay, feeling for lymph nodes down here in her head. I don't feel any up and through her cranium. Okay. Alright, now I'll move down into your chest. I'm going to be looking for symmetrical expansion. You take a deep breath for me and let it out. Alright, I'm noticing her shoulder blades are even here. That's great. And next I'll be doing the tactile fremitus, which will test for sound vibrations getting through the chest. So every time I touch this part of my hand, if you would say 99.
99. 99. 99. 99. 99. 99.
Okay. I was able to feel the vibration in my hand. Alright, next I'm going to percuss each space. I do not feel any dull sound. That's great. And next I'll go ahead and listen through all the breath fields. We'll be using the bell of the stethoscope into the inner 1/3 of the clavicle. Thank you. We'll be flipping it around and going to the second intercostal space. Second intercostal space. Fourth. Okay. And then the sixth. Another deep breath. Thank you. Her breath sounds were clear, both upper and lower lobes. And now what I'll have her do is whisper the phrase 99, and I'll listen to hear again for any accumulation in the lungs. Just whisper
99. 99. 99. 99.
I was able to hear her say that through there. So I'll have her go ahead, and if you could turn around for me, I'll listen to the back and assess the posterior side of the lungs. So again, I'm just going to assess for symmetrical movement. Can you take a deep breath and let it out? Go ahead and take a deep breath and let it out. All right. She doesn't have, do you have any tenderness?
No.
I don't feel any tenderness or masses. Next, I'll go ahead and do the tactile fremitus again. Can you say 99?
99.
Okay.
99.
Okay.
99. 99.
Keep going.
99. 99. 99. 99.
I was able to feel the vibration on the outer part of my hand. I'll go ahead and do my breath sounds now. All right. This would be at T1. Okay. T3. T5 or T7. T7. T9. And T9. Okay. What I'm going to have you do now is whisper 99.
99. 99. 99. 99. 99. 99.
That's great. And then I'll have you just say the letter E and hold it for me.
E.
Okay.
E. E. E.
Alright, and that was for the E to A sound, and the E stayed similar. It did not transform into an A. And so now what I'll be doing, if you could turn around again for me. Thank you. And I'll be assessing her heart sounds and also her heart rate. So first I'm just going to listen to the valves of the heart. Here I'll be doing the aortic valve, and then move on into the pulmonic valve, and then down to the tricuspid valve, and then over the aortic valve, where I'll be counting the apical pulse for a full minute. I was able to hear heart sounds S1 and 2 and hear a regular rate with her sounds. So this concludes my health assessment video. Thank you very much.